I'm Dr. Robert Pugach. If you're watching this, you're probably concerned about prostate cancer. Maybe you haven't been diagnosed yet. Maybe you have and are worried. Maybe you're scared. What you're about to see is something quite remarkable because we're going to do what's called a prostate cancer focus group. And you're going to meet a lot of people who have had prostate cancer. I've had prostate cancer and I was treated with HIFU last year. So what I've learned over the years, and I've put a lot of educational materials together, I've put together websites and articles, and I do a lot of seminars, is that probably the best way to understand what you're comfortable doing is to talk to other people who have been down the road that you're about to go down, or you're thinking about going down, and you just don't know where to go. So what we're going to try to do tonight is relate our individual experiences about a number of topics related to prostate cancer to help you get more comfortable and make the correct decisions that are right for you. With that said, I'd like to start by asking everyone to introduce themselves. Maybe go down one by one. Just say who you are, and if you want to say anything about when your cancer was diagnosed, you can. If not, the name is fine too. So we're going to keep this nice and informal.
Hi, my name is Mike Ayala. I'm diagnosed with cancer about 2 years ago. Had an operation just last year, and it's very successful.
I'm Monica Ayala. I'm his wife, and we were just, we discovered HIFU just by coincidence, and that's what he chose to do.
My name's Tony Baez. I was diagnosed in 2014, had the HIFU procedure the same year down in Puerto Vallarta.
And I'm Winston Miller. I was diagnosed in 2008, 10 years anniversary. I went down to Puerto Vallarta and very pleased with it.
I'm Brendan Masterson. I was diagnosed in April, I think, of 2016. Had the surgery in June 2016 here in California.
I'm Barbara. I'm his wife.
I'm Greg Dahlstrom. I was diagnosed in October of 2016, and I had the HIFU in February of 2017.
Hi, my name is Mimi Dahlstrom, and I'm his wife, and I'm here to support him. And I was really surprised how HIFU was really a great experience.
Mm-hmm. Yep.
I'm Bill McCracken. I was diagnosed in February of 2015, went to Puerto Vallarta in March and had the HIFU at that time. Great experience.
I'm Dulcie. I go with him. We can't say enough positive things about how everything was handled, the outcome, the ease of it all. Very pleased.
I'm Jeff Kuba. I was diagnosed in September of 2015 and had the HIFU procedure in Puerto Vallarta in December of 2015, and absolutely fabulous results.
A lot of folks have said they had this in Puerto Vallarta because that's where we had to do it years ago. And in 2015, at the very end of the year, the FDA finally approved HIFU for the US. It's actually been out for almost 20 years now. And it's available in 45 countries, but what you're going to hear is the experiences of folks who are very much like you and had a diagnosis made and difficult decisions to make. One really interesting thing that was just said, Mimi, you said it about supporting. Don't underestimate the importance of people supporting you. It's very important to include your families in the decision-making process. It's important to be open about this. Sometimes guys have a problem with that. Sometimes guys don't ask a lot of questions about our health. And it's important to do that because the more that you understand, the more that you learn, and the more support that you have, the easier your road's going to be. So I thought what we'd start with is a question about how cancer was diagnosed, but what that was like. Because nowadays there are some concerns that some people have about diagnosing prostate cancer, that there shouldn't be PSA testing, that biopsies are very dangerous, that sometimes we're overdiagnosing prostate cancer. So what I thought we'd do is start with that issue about how prostate cancer was diagnosed, how maybe a PSA was done, and rather than just do what we did going in a circle, just feel free to jump in at any point, and anybody who wants to start, we'll take it from there.
Basically, for me, what happened, probably about 7 years ago, I went to a facility. My count was about 4.5. And being a man, I guess, I didn't think much of it. And I went along with life, raising my kids. And I went into Kaiser because of my wife. And again, my count went to 11.1.
Wow.
And I was pretty much in denial. And my doctor eventually called me and inevitably ended up with Dr. Pugach, and everything turned out fine.
I was diagnosed about, again, 2015, but I was under a watchful waiting process with my internist. And he had been doing my PSA, and it kind of fluctuated up and down, and then it was up in the 5.5, 6.0, and he was concerned after a year and a half, and he sent me over to Dr. Pugach, and that was a real good move. In fact, this doctor that I've been going to for 30 years, he had 5 of his patients come over here and do the HIFU, and had great results.
For me, I have had in the probably the past 20 or so years, I have had regular PSA exam whenever I would do my physical, and everything, numbers were always great. And somehow after doing it in the 2007, second half of 2007, numbers were good. We were somewhere about 1.5, pretty good numbers, I think. And maybe about 2-3 months later, I wasn't feeling myself for some reason. I don't know what it was. But I went back to my doctor, and he did a PSA. And the numbers were like 6.5.
Wow.
And I recall him saying, a great doctor, by the way, but I recall him saying, you know what, you've always had good numbers. Let's watch it for a little while and see if, it changes in another few months. And I said, no, let's do that biopsy. I just don't want to mess around with this thing. So he said, fine, go ahead. And we will do the biopsy. And we went out and we did it. And sure enough, it came back that it was cancerous. And he and I, we haven't seen each other in a while, but we still have the running joke that, I was so insistent that, it was good that I took that position. In any event, we went ahead and met with a few other doctors and eventually, did some research. Never heard about HIFU, but after doing some research, we decided to take a further look at it, and here we are today, so.
Yeah, my experience was I was just on a regular physical, and my good number was good, or bad. The good number was
Free PSA.
yeah, the free PSA, and so they just put me on an antibiotic and said it's probably just some inflammation. And then when I went back, it was actually worse. So they sent me over here, and actually when I went to get a second opinion after I saw a doc, the guy said, I don't think I would have biopsied you. So I was really happy that, first of all, my doctor sent me here, and that he biopsied me, because I think that if I had gone to another doctor, I don't think I would have been biopsied. And we had to do it right away, right?
Yeah.
Yeah. So.
Well, I'd been watched for about 5 years. My PSA went from about 4.5 the first time they did it to 6.8. At that point, I was seeing a urologist, and he suggested the biopsy. And to be honest, that was the most painful part of this whole thing.
Don't remind us.
That hurts. Including all the HIFU, that's the worst part.
That tickled.
Yeah. And the choices at that time were given me by that doctor were surgery and radiation. And my wife, thankfully, basically said, no, those aren't those choices. Those aren't the choices we wanted to. And we first looked at cryoablation, and Dr. Pugach's name came up when we looked at cryoablation. And it turned out a friend of mine had already been going to Dr. Pugach and suggested I go see him. This was before I even looked into this, so it came twice. I thought, I think we better go see him. And found out the cryo ablation wasn't for me, but the HIFU worked out real well. So that was thankfully, it's a very good thing, and it really worked out well.
My story's a little bit different. My father had prostate cancer, never died from it. He was 91 years old. So when I was about 63 years old, I get a renewable term life insurance every year. So they do all these types of psychophysical, blood, everything, SA 2.5. But I always was kind of concerned because my wife is a doctor, ex-doctor, her family, and they say genetics and things like this. So I said, the test is good, but I just want to make sure that the prostate is the normal size. So there was a little office next to where we live. I saw his name, and I said, okay, I'll just go there. It's just going to be simple, in and out. I'll be fine. Just, okay. So made an appointment. Yeah. And did you have a PSA free test? No, I had a PSA test. What was it? 2.5, which was really good. And he goes, have you PSA free? I go, what? He goes, you're going to get one. So, okay. So I went and did it, and I got a call. And they said, your number is 11 something. And if you don't have cancer, you will get it. And that's when Dr. Pugach said, we need to do a biopsy, and did it, and came back in, and I learned about it. It's just 4 quadrants, and one of the quadrant was 85, the other one was 15. So, yeah. I'm a lucky guy. Very lucky.
But you also faced up to what was a possibility. You put your head in the sand.
Yep.
Maybe a good takeaway message in this very first topic is free PSA. If your doc's not doing it, and your doc probably isn't, tell your doctor that you want one, because there's a total PSA, but we diagnose a lot of prostate cancers very early because of the free PSA. So ask your doctor for that, and if it's not over 25%, go to consider a biopsy. My total PSA was 1.1 when I was diagnosed, but my free PSA was 18%. It's supposed to be over 25. So I called my doc and I said, let's do a biopsy. And I agree, it wasn't a great experience. But we got it done, and the rest is history. So after the diagnosis is made, so now you have that biopsy, what's it like when you come in the office and you're saying to yourself, oh, I'm sure it's negative, or I'm hoping it's negative, and I'm just going to get a great report, and I'll see you again in a year's time, and the word is your biopsy is positive. What does that do to you? What either goes through your mind, or do you stop thinking? What happens?
One of the things I was thinking of, what am I going to do in terms of correcting that situation? 3 of my good friends who I golf with, they had cancer. One of them had the prostatectomy, and it didn't go well at all. So I knew that with all the problems that he had, I was concerned about going in that direction. The other 2 guys had the radiation, but it was an 8-week process, 5 days a week, 40 sessions, and they weren't sure whether, that was going to work. So right away, what am I going to do? And I went to Dr. Pugach, and he gave me a list of things that were possible, and it was the HIFU that I said, hey, that's the way I want to go. I don't want to have the problems that some of these guys have had.
I was scared. I was really scared, and ended up getting an appointment with my urologist, who only gave me the choices of surgery and radiation. And my wife asked him, well, what would you do if you were in this situation? And he said, I would have surgery. But they don't tell you all of the effects. What is life like after this? Sure, it'll take care of the problem, maybe.
Right.
What is life like after this? And that was really scary. And it took us a long time. My wife prodding me to go, and she was searching the internet looking at what's possible, because they don't tell you. what's possible. Unless you happen on somebody like Dr. Pugach who does these procedures regularly. And I had done it when he was in Puerto Vallarta, wasn't approved, so that was a little nervous for me. Should we do this? Is it approved? Is it, we had to pay for it, but it was really scary. It's about a month of kind of, and the doctor told me, call me when you make a decision. Well, I never did call him, and he never called me back, which I thought was sort of a telling thing about how much he may have cared for where I was going with this. So it was frightening, but I think getting out there and looking at all the possibilities that are beyond what the normal medical doctors are going to tell you. The surgeons, they only have a hammer, so they give you tell you you must be a nail. So they're going to give you those choices, and it wasn't right for me.
I think as a spouse of patient going through it, it's also, I ended up doing most of the research because he was really scared, as Dr. Pugach knows. I made the appointment for him before, he didn't even know what was going on, but I spoke with people in Colorado and other places. His name came up as he was having a seminar, but I can't remember, we couldn't make that, so I just made him an appointment. And and then from that point on, it was history, and it was done here, and it all worked out. But yeah, it's a lot, it's very scary. But the research, you're absolutely right. The research is there, you just have to do it.
I called UCLA and a couple other hospitals, and the founder was right here.
Yeah.
Dr. Pugach. It all came back to Dr. Pugach.
Did they know?
They knew his name.
Okay.
They knew
Yeah.
his
Well, that's
name.
good.
Everywhere I
That's
called,
great
they knew
news,
his
yeah.
name.
For me, in 2007, I never heard about HIFU at all. So when it was diagnosed, obviously I was pretty scared. I didn't want to think about surgery. Radiation was probably the thing I was leaning towards for some reason. But I also went to UCLA and met with an oncologist. I wanted to get as much information as I could. Spent a lot of time researching, but I told a good friend of mine what was happening. And unbeknownst to me, he put one of his staff to do research on solutions for prostate cancer. And he called me one day and he said, I have something to show you. Would you come down to my office? And I did. And he had this package this thick. And what he had done was compare several different treatments, including HIFU, which I never heard about. And he said, you know what, Winston, I looked at all of these, and there is this thing called HIFU in there. He reviewed it himself, and I think you will like that. And I said, let me look at it. And I took it home, and probably for the next 2 or 3 weeks, I studied it. I remember my urologist told me that I was taking too much time, that this could be dangerous, but I wanted to do my homework. And after doing my homework, I concluded that HIFU made the most sense for me. Never heard about it. It wasn't FDA approved. But I got onto the HIFU office in North Carolina, had a lot of conversations with them, pros and cons and so forth. And I said, well, now what if I want to do it? Where would I do it? And they gave me a couple of references, people who had done it already to talk to, some around the country, but there was somebody in Irvine. And I said, so how did you get yours done? Where? He said, there's a doctor out here in Los Alamitos. I said, oh, wow, okay. But by then I had decided this is what I wanted to do. And so that's how I got connected with Dr. Pugach. The challenge I had, because it was so unknown, my family, except my wife, didn't want me to do it. They thought I was absolutely crazy. And so, I just had to take a pretty strong position. My life, I got to live with the options, at the end of the day. And I would like to feel that if I'm wrong, then I made a decision for myself. And so I came out and saw Dr. Pugach. We liked what we heard. And then all of the references I talked to were really inspiring. There was one fellow who was a surgeon in Arizona, and he said, Winston, promise me this. Don't even think about it. These guys know what they're doing. They'll do a great job. Don't worry a minute. Just go do it. And that saved me a lot of stress, concerns, and everything else. So by the time I got to Puerto Vallarta to do it, I was pretty relaxed. I was very relaxed. So that's, but I look back at that and I thought that was the best gift that I could have had. So, thank you.
Well, mine was a little different because I was educated in prostate cancer, again, through my father. So I kind of grew up, I was an older man, I was probably well into my 40s. And when he was diagnosed, he had basically 3 options. That was surgery, radiation, and they had this new thing called radioactive seeds, and I guess they still have it. So he chose that one, and it went terribly wrong, and it fried his urethra. And for about the last 16 years of his life, he had to wear a bag. So, but he never didn't die, but of prostate. But it was always a struggle for him, always a struggle for him. So when this came, I was a little bit shocked, and I went home, told my wife, and she said, "Oh my gosh, no, it's gonna be okay," And he had already told me about options, and I like technology, and he told me each one of the 4 or 5 procedures equally, and I knew that the new one, HIFU, was the one to do because it's new, and he told me it had great results. I knew that radioactive seeds and the other alternatives wasn't the way to go, so that was my process. Again, I was lucky. I had no symptoms. It caught me totally off guard. Totally off guard.
That's even harder.
I was yeah.
Yeah.
That was a shock.
I didn't symptoms either.
Yeah.
Yeah, for me, I don't know. I try to say I don't worry until I have to worry, and I suppose that's true. But obviously, when he told me, I began to worry. But he told me the thing that made me feel the best in that meeting was, I know it hasn't spread. I just have to prove it. So we had to go do those processes, and then what he said to you.
Yeah, he just looked me in the eye and said, "He's going to be okay. I'm going to take really good care of him, and he's going to be okay." He just knew.
So in that moment, I was fearful, but I also felt really confident. So.
Dr. Pugach talked about men's health and how reluctant we are to talk about our problems. And I was one of those guys that totally afraid of doctors. And I hadn't been to a doctor in probably 25 years. And I was 56 years old. And unfortunately, I got an infection. And, at that point I said, well, you got to go to a doctor now. And my wife and I called Dr. Pugach our miracle doctor because we found him online and just, out of the blue, just saw him and came here. And Dr. Pugach said, you got this infection. I'm going to take care of that. That's no problem. But, you haven't been to a doctor for so long and you haven't had any tests and whatnot. He says, and we're going to take care of that. So, immediately gave me an exam and sent me over for a PSA test, which came back okay. I was 2.5, which is probably okay for my age. So, but, he put me on a routine and he tracked me and I had routine PSA test. And when it got to a little bit over 3, he said, I see it's gone up to 3. I want to do a biopsy. And I said, wow, it's only 3 point something, do we need to do a biopsy? He said, yeah. He said, in my office, we do a biopsy when it gets to be over 3. So, did that, had the biopsy, that little unpleasant experience that we've all talked about, but, and it's really not that bad, but came back positive, had a Gleason score of 6, and, the doctor kind of thought that we had got it at a very early stage, and he was very thorough, talked about all the different options that were available, the robotic surgery and radical surgery and several different, and then we talked about HIFU. And we talked about the after effects and side effects and the procedure. And, you know, I was very confused and frightened, and finally I just asked Dr. Pugach, I said, if it was you, what would you do? And he said, I'd do HIFU in a minute. So I said, let's do it, you know, and he did, went down to Puerto Vallarta, because that's when we still had to go down to Mexico. But as everyone said, it was, you know, I hate to say it was a pleasant experience. It was a great experience, but you know, you got prostate cancer. So, but really going down there was a great experience. And, you know, I've had good numbers for the last 4 years now, and, you know, come in here every 6 months and see all the good folks here, and just a good experience.
You know, maybe that's another important takeaway is what's the proper cutoff for a PSA? Because traditionally we've said 4, and some people have said as you get older you can have as much as 6.5, but that's actually not true. The absolute cutoff is 4, but when you were in your 50s, the cutoff is 2.5 actually. Because if we use that as a cutoff, we find a lot more cancers. And a really good reason for using a more strict cutoff or getting free PSAs is like any disease, whether it's cancer, whether it's heart disease, you know, you want to see your doc when you're getting some chest pain, not when you have a heart attack. You want to see your doc when the PSA is 2.6, not when it's 26. Because what we're going to find on a biopsy is very, very, very different. I saw a new fellow today whose PSA is 42. And I already know what I'm going to find when I do a biopsy, it's not going to be good. So it's much, much better to get your doctor to not just do the test, but ask for the result. And have your doctor explain it to you. And if it's your primary care doctor, internist, GP, family practice doc, that's fine, but maybe you want to contact a local urologist and ask the urologist what he or she thinks about your PSA. Because ultimately our health is in our hands, right? It's not just someone saying do this, but you take control, as everybody here has done. So what was the day of the procedure like? Were you nervous? What goes through your mind? When I had mine, I knew what to expect because I'd done it a whole bunch of times before for other people. But what was it like?
I was completely relaxed. I knew that I was in good hands, and I was out for 5 hours. And when I woke up, I have to say, no pain at all, no pain medication. There was nothing. There was no pain at all. I mean, after a while, you know, the catheter's a little uncomfortable I had it for 3 weeks. It was a bit much, but there was no pain. There was never any pain. So I think that because it's a non-invasive procedure, unlike surgery, there's no pain at all, none.
I was pretty relaxed throughout, and the treatment went well. I think it was 4 hours. I don't remember. And what I can recall is that we got back to the hotel. My wife and I relaxed. We met another couple, much older couple. They did it. Their husband did it, and we went out for dinner the evening.
My procedure was later in the afternoon, and I think my wife and sister was there. Got home about 6:30, and Dr. Pugach said I could go to work the next day, and I have my own business, so I did. And I go, what am I doing this for? You know, I felt fine. I felt perfectly fine. And I took a couple of days off on the weekend, and I went back, and no problem whatsoever. 0 problems.
My procedure was done on July 17, 17. And the funniest thing about it, I remember looking at the clock and it's 7:17 when the guy put me under.
That's
Wow.
And while we were there, we had another baby born while he was in there, in our family, so.
But the procedure was excellent. No pain at all. Afterwards, no pain at all. This is really something. It's something I had to do and be responsible as a father.
I experienced pretty much the same thing. I didn't have pain either, and I knew I wasn't going to because of all patients' experiences before that. But I'll tell you a funny story. So the guy that did mine is someone that used to go to Puerto Vallarta around the same time I would, and we treated patients the same days usually, so we got to know each other really well. He was in Northern California. And so when I had my HIFU procedure just beforehand, that morning, he said, hey, look, by the way, if you're feeling okay this evening, I'm going to be having dinner with a few urologists that are interested in adding HIFU to their practice, and I'm maybe teaching them. Would you mind stopping by the restaurant just to share your experience? I said, if I'm up for it. So 6:30 that night, my wife Kim and I are in Ruth's Chris Steakhouse, and I'm having a glass of Cabernet and cutting into a big old Ruth's Chris steak. And Michael, the guy that did my procedure, said, by the way, everybody, Bob had his procedure this morning for HIFU. And so we flew home the next day, and 48 hours later, we're on a plane to the East Coast for a family event. So most of the time, there really is no significant downtime or pain. Does it happen sometimes? Sure. But the vast, vast majority of us really do well after this. So what happens, you had your HIFU procedure, hopefully the post-HIFU course is nice and uneventful as everyone is talking about. And then it's 3 months later, and you come in and you want to get the results of your PSA. Or it's 3 months after that and you're waiting for your PSA result. Is it, okay, I know everything's great, I just want to hear the number and go back to work, or is it, uh-oh, did it work each time?
It's very scary.
It is.
Every single time.
Every single
It
time.
takes a lot of them to 2.5 years for me. It's taken a long time to finally say, all right, it's done. It's very scary every time. But it's okay. That's part of the process.
I think it's very scary every 3 months when we come for
I like it.
Yeah, it is.
I like it.
results.
But you always make me feel good because my number will fluctuate a little bit, right?
Mine does too.
And so we have a strategy for it, but I don't like it, but by the time I leave, no matter if it's a good read or a fluctuant read, I feel good by the time I leave.
I think he would say something if there were any real concern. I mean, I think Bill's had a concern a couple times, and Dr. Pugach, it's fine, it's no big deal,
Yeah.
go up and down, you know, it could be this, could be that.
He
Don't
said it
worry.
when I had to have HIFU, you know, like you're saying.
Yeah,
When it was serious, it was serious,
Yeah,
and I knew it.
Yeah.
And when I leave and he says I'm okay, I feel like I'm okay.
exactly.
I wasn't really too concerned, to tell you the truth, because I felt so comfortable and so educated by Dr. Pugach that I just knew it was going to work out well. And I look at these come back every 3 months, almost kind of, do I have time for this? Do I have to do this? I mean, that's the way I feel.
Yeah, I sort of echo your comments as well. You know, after 10 years anyway, you know, you kind of don't even remember about this. I don't think about it, to be honest. In fact, a relative of mine asked me a few years ago, how's your cancer? I was offended. 'Cause I don't have cancer. So, and that's the way I've treated it, and I no reason to think otherwise. But thank God, whenever we get here, it's always been a good experience. So we just say, okay, see you in 6 months.
Yeah.
And it's been good.
I have a really close family member who had his HIFU 11 years ago. And whenever he gets his PSA, he calls me, and he still says, yeah, a little bit concerned. It's long enough now that if anything were to change, I'm okay, because if I needed to have HIFU again or something else, I can certainly do that. But he, 11 years later, looks at that. And that's another important thing also, that if we have a prostate cancer that's treated no matter what the method is, you really got to go for follow-up forever,
Right.
because it's important. You just got to be sure.
Yeah.
And it's, you know, a simple enough thing to have a blood test and a quick exam and get back to normal activities. What's your advice to somebody who is on the fence about either getting a PSA or knowing what the PSA is and having been told that he should have a biopsy? You've been through a process where you took it upon yourselves to have the biopsy done and then move forward with treatment. But here's someone watching this maybe who's thinking, these guys are not saying good things about a biopsy. Maybe I really shouldn't have it done after all.
The big suggestion that I would make is wear earplugs. That's the thing that really startled me. You know,
The noise
I
of
mean,
the
everything was
machine.
pretty well anesthetized, but you know, when that spring kid in there.
Last thing I can think of to talk about, and anything else you guys want to talk about, let's do it, but what advice can you give somebody who had the biopsy? And let's say the news is relatively good, that it's hopefully an early cancer, it's confined to the prostate, it's not a super aggressive one, or even if it is aggressive, but hopefully it's confined to the prostate. But now comes the period of indecision. Now it's, well, what do I do? How do I make the right choice? Do I have surgery? Do I have radiation? Do I have freezing? Do I have HIFU? How do you push someone to make the right decision here, if that's the right way to say it?
Well, for me, it was experience with my father again. God bless him. I learned so much by what he went through, some of the mistakes, and I knew what I didn't want, and so it was a little easier, I think, for me.
I think it's real important to look at the long-term outcome of any of the procedure. First of all, you need to do your homework. You need to look at all the options, not just the ones that one doctor may give you. And the internet has that information. Doctors like Dr. Pugach has that information. You need to look at all the options and look at the long-term. Don't say, well, it might be all right if I'm incontinent. No, that's not the way to live.
Nope.
That's
Yeah.
not right.
Nope.
It's all right to be sexually dysfunctional. No, that's not right. You need to think about, well, how are you going to live with this over the long term? I was 59 when I had the procedure, so.
One of my colleagues, okay, had the prostatectomy last year. He's 82 years old, retired coach, and he's wearing diapers. I don't know whether it was a money issue or what, but he had the prostatectomy, and I think he regrets it.
I had a gentleman I spoke with in Colorado, he said, he sent me an email, he said, it's your life, take control, have your husband take control of it and choose well. Those are the best words anybody
That's
could
great.
give you,
Yeah.
We
it's
are
like-
all young men here, and
Yeah, you are.
You don't want to be running around with a bag or in
Right.
diapers.
Exactly.
We have a long life to live, a good life, and that's important.
I think a real mistake, and I heard this from other guys, might have been like your friend, I just want the cancer out of me, just get it out of me.
Yeah.
I think that's a real mistake. I mean, once he told me it was contained, and we did the Lupron, so it wasn't growing, I wanted to make the right decision. Is that right? Lupron? Is that right? That I wanted to make the right decision, and he made me feel so confident that we'll get it out of you, but don't just, well, you didn't say don't take it out, but I felt like, well, if I can keep my prostate and keep my life the same,
Yeah.
I think that's a real mistake to have that feeling of just get it out of you.
Yeah.
That was my first.
Yeah,
Fear.
I get that,
Yeah.
right? Like, me too,
Yeah.
for sure.
My wife said, no, that's not
Yeah.
what you should.
Yeah.
And you make the decision together.
Exactly.
That was real important for us
Yeah.
to do that.
And I honestly don't see why, unless it's truly financial, you would not do
Yeah.
HIFU
Yeah.
as your first option, because those other things will still be available.
Right.
But HIFU is just, if it's contained, I don't think you have any other decision, as long as you can work it financially.
Yeah.
I think different people, because we have a friend of ours, he's an anesthesiologist, and he chose to do the robotic about 2 days before or after. You had yours on Monday, he had his on the Friday before. And he has had issues. And, and he knew all the options, but that's what he chose to do
Yeah.
because he felt like, okay, well, this is gonna be gone. And he has faced issues.
And it's all of your decision. I mean, we can't tell somebody.
Right, exactly,
It just kind
exactly.
of makes sense to start with this,
Yeah,
because you can always go.
Good have the
rest
other,
of
And
right.
they'll never forget,
Yes, exactly,
he said, you can't correct it.
exactly.
right,
Yeah.
I mean, I can't.
yeah,
It's pretty powerful.
yeah.
Yeah.
Well, his dad had called him and talked about it, and, because he didn't tell his family until before the procedure, just as my husband did not tell anybody in the family till a week before.
Right.
It was a decision that was just gonna be made that way, and, he called and we tried talking to him about it, and he knew about it, and he just chose to do it. So,
Yeah.
it's unfortunate, but it's what happens.
Well, I think we all owe you a democrat.
Yeah.
Thank you
Yeah.
so
Yeah.
much.
So much. Right.
would add one more thing, and that is, I'm always supportive of whatever decision you make for treatment. If you said to me, I want to have surgery, I'd be supportive of that, and I'd follow you afterwards. But in making a decision about that, or anything else in healthcare, it's important to really understand what a statistic is. If somebody says to you, there's a 1% chance that this might happen, there are two numbers out there. One is 1%, and the other is if it happens to you, it's 100%.
Yeah.
And so you have to say to yourself, all right, now I understand from the statistic whether this is likely or not likely to happen to me, but if it does, how am I going to live with the side effects, as you were saying? So I think it's important to really step back and make a decision. It's also important not to get frozen and say, well, I'll take another week, because
Right.
you know what? A light bulb never goes off in our heads going, aha, I see the light. It's, this makes the most sense to me for whatever reason, whatever concerns I have, and you go with that. And you probably second guess yourself sometimes, and that's okay. But in the end, you do the right thing for your individual health.
Right.
And I think everyone here tonight is just in a fabulous service to everybody who's going to be watching this to help you make decisions, just like we've all made them.
I got to tell you, I have never had a second perspective on it. I've never regretted. I never said I should have done something else. So, what it's worth.
10 years.
I want to thank everyone again, and let's give each other a round of applause.